In other news this evening, it's been 3 weeks now since the first COVID-19 vaccine was administered here in the U.S.
Caitlin, that was the Pfizer vaccine. So now it's time for those who were vaccinated first to get their second dose. That includes this ICU nurse in New York City. She was one of the first Americans to get vaccinated, and today she got that second critical dose. 41 Action reporter Jordan Betts explains how hospitals are preparing to administer the next dose to frontline workers here in the metro.
It's been 3 weeks since Truman Medical Centers started vaccinating their frontline workers with Pfizer's COVID-19 vaccine. This week, they'll receive their final dose in hopes to end this pandemic.
I got my second dose of the Pfizer COVID vaccine.
It's another step at beating COVID-19.
I've had a lot of shots over the years, and this was felt just like any other shot.
Dr. Matthew Gratton is finishing his process in getting the COVID-19 vaccine. Each vaccine is different in the amount of time people have to wait to get the booster. Pfizer has a 21-day wait time between doses, while the waiting period for Moderna is 28 days. The second dose is essential to protect yourself from the virus.
They determined in the research that one shot really wasn't enough to activate your immune system enough, and so it requires a second shot. And with that second shot, it's approximately 95% effective, which is fantastic.
That's why it's critical no one misses it.
When they gave it in the study, between doses and the amount that they were given were kind of all carefully plotted out by the people who organized the studies. And when we talk about the high effective rate of this vaccine, it's based on those studies of people that got second doses in that time frame that the study had dictated at the beginning. So I think when we go outside of that, we don't always know what does that do to our effectiveness, or how far can we really push it.
Symptoms could appear after the final dose. Dr. Gratton says they would last less than 24 hours.
While the symptoms may be uncomfortable, they're really not that bad.
Just because you get both doses doesn't mean you are immune.
There is some evidence you still might be able to get the virus and just not be symptomatic. And so it's still important for me to wear a mask to protect the people who are around me.
In Kansas City, Jordan Betts, 41 Action News.